Hello, everybody. Welcome, welcome. I'll give you all a moment just to get settled and get set up. Welcome to this Q online visit. Lovely to see you here. I'm Julia from the Visits Collective. We'll be doing some introductions to the hosts in a moment. Just going to give you a moment to get settled in. If you could, I think you're all on mute, but if at any point, if you come off, if you could just pop that back on, that'd be great. If you're able to and comfortable to, it would be wonderful if you could turn on your video. It's lovely to see some faces, and you can do that on the toolbar that should be at the bottom left of your screen. If you need to, you can rename yourself by pressing the 3 dots in your profile picture if you've joined accidentally as iPhone 367 or one of your colleagues' names or something like that. You can rename yourself and we will get started. And as you're joining, please do say hello in the chat. Take a moment to introduce yourself, say hi, tell us where you're joining from. And we would love to hear if you have something in mind, one thing, person, something you've read, something you've listened to that has inspired your QMS journey. It'd be lovely to hear about that in the chat too. I think there's lots of expertise in the room and there'll be lots of brilliant resources as well. We'll just give it another moment or so for people to join, and then we'll get started. Great to see some of you introducing yourselves in the chat. We are going to be recording this visit, so we're just going to press record now, and then let's get started. So welcome to this Q online visit. Hopefully this is what you were expecting to join today, Improvement Cymru's journey as a learning organisation and their focus in particular on developing a quality management system. We're really, really excited to hear from Improvement Cymru about this today. And I know there's a lot of expertise in the room, lots of you joining with expertise, and there's going to be plenty of opportunities to share that too. We are the Visits Collective, myself and Vicky. I don't know, Vicky, if you want to come off mute and say hi.
Hi, everybody.
We work with the Q team and the Health Foundation to help run a range of learning visits for the Q community. I can see some of you who I know I've met before on those visits, which are great. And the purpose of the visits are really to give you an opportunity to step into somebody else's world, to learn a little bit about how another organization thinks about things and approaches things, and to take back that learning into your own organization. So today we're learning all about quality management systems. We're really excited to be hosted by Improvement Cymru, and I'm just going to invite each of the hosts to come off mute and say hi and introduce themselves so you can spot them in the crowd, because it is a big visit today. We've got about 50 odd people in the room at the moment. So Dom, do you want to come in and say hi?
Hi everyone, good to see you all, and some known faces and known names in the chat there as well, so it's great.
Lovely, welcome Dom. Felicity, do you want to come in and say hi?
Hi, morning all. Great to have you with us. And I too was looking, thinking, oh, I recognise that name. I'm waiting for some of the faces to appear to check it is the person I think it is. But lovely to have you with us.
Welcome. And Karen, do you want to come in and say hi?
Hi everyone, Karen, it's great to see you and really looking forward to visit and talking to you today.
Brilliant. And last but not least, Rochelle, come on in and say hi.
Morning everyone, I'm Rochelle, looking forward to learning with everyone. I've recently joined the team.
Brilliant. So you're going to be hearing a lot from the team throughout today, as well as from each other. A few things to know. As you know, as we said, as you were joining, we're going to be filming this session. Feel free to have your cameras off when we're not in discussion mode. You'll be in breakout rooms some of the time, and hopefully those are the kind of key moments when it'd be lovely to see your faces so you can have a chat with people around you. Closed captions are enabled, so if you want to use these, you can press show captions or CC on your toolbar. Vicky, I wonder if you could hop on 2 slides forward for me to the agenda. Just to let you know, this is the shape of the session this morning. We'll be having a break at about 10:35. If you need to take a moment away from the screen or go to the loo, do it. That's absolutely fine. You don't need to let us know. If we're about to go into breakout rooms, which we're going to do in about 35 minutes, you have the option to just stay in the main room. If you'd rather spend some time reflecting, silent and solo, that's absolutely fine. Just let us know and we won't put you into a breakout room, or you can reject the breakout room pop-up if you'd rather stay in the main room. We're going to be doing a check-in in moments, in a few moments, in some breakout rooms, so you'll get the chance to meet a couple of other people who are on the visit, and then we're going to hear about the journey that Improvement Company have been on, and then you're going to have a chance to discuss your experiences so far. We'll do a little bit of Q&A after that before the break, and then we're going to be going into a practical example, so applying quality management systems, and that example is going to be around experiences of working during COVID. So you're going to have a kind of live example from the team, and then an opportunity to think about applying that model in breakout rooms in small groups too for yourselves. And we'll be wrapping up with some kind of lessons learned, plenty of time for Q&A, plenty of time to be hearing from all of your experiences too. And if you're just joining us, welcome. We're only just getting started. If you're not used to using Zoom, there is a little function on the toolbar that is a hand that says raise hand. So that's how you can give us a wave if you'd like to come in and ask a question in the Q&A. But do use the chat, do kind of say hi if you're just joining us there. That's also a great place to share your reflections, your experiences, things you've been learning about QMS on your journey so far. If you're struggling with your video connection or hearing us, sometimes it can help to leave and then come back in again. Sometimes it's because Teams is on in the background. That can sometimes cause issues. So maybe try shutting that down. That can sometimes help too. I think the only other thing I would say is if you're not, I know lots of you are Q members, but if you are not already a Q member, then we're going to pop the link to join in the chat in case you're interested in finding out more. Thanks, Vicky. Vicky's just popped that in there. And there's also a very active Quality Management Systems Special Interest Group, or SIG, and we're going to pop the link to that in the chat as well. I know many of you are already on that and have had some lively conversations on there recently. And if you're active on social media, we're going to drop the Twitter X links for both Improvement Company and the Q community in there in case you want to be live tweeting some of your reflections from today. Vicky, if you could stop sharing there, that would be fab. Thank you. And brilliant to see all of your messages in the chat. What an amazing group of people we've got here for this visit today. Really exciting. I think those of you who've been on a Q visit before will know that a huge part of the visits is about the chance to meet other people and make connections. So we're going to give you about just shy of 10 minutes in breakout rooms with 2 other people to say hello. And we'd love you, we're going to pop a little prompt in the chat for you, but it's an opportunity to introduce yourselves and then share one thing that you would love to learn today and one thing that you'd love to contribute. So something you'd love to learn about today and something you'd love to contribute. Oh my gosh, I'm so distracted by Lisa's gorgeous dog in the background. Gorgeous, gorgeous, gorgeous dog asleep in the background. So one thing you'd love to learn today, one thing you'd love to contribute. Have a little think about that while we set up those breakout rooms. As we said, if for any reason you would rather stay in the main room or are not comfortable in a breakout room, just reject the pop-up and you can stay in here and have some quiet time. And just going to pop that prompt in the chat. And then in a moment, we're going to open those breakout rooms for just shy of 10 minutes. And we'll let you know when we're closing the rooms. So you know you can finish your sentence or wrap up the conversation. Vicky, let me know when you're ready to roll.
I think I'm ready. If anyone, we're mainly rooms of 3. There are a couple of 2s. If anybody gets left in a room on their own, I'll try and keep an eye out and move you. But just let me know if you need any help. So I'm going to open the rooms now, and it will give you an option to join your room.
Enjoy the conversation. We will see you soon. And those who are left in here, that may be intentional, absolutely welcome to stay in here if you are still wrapping up some work or just wanted some silent and solo time. If for any reason you're having issues getting into the breakout room or it hasn't come up with a pop-up, let us know and we can try and troubleshoot that with you. I'm just looking through Vicky to check whether I'm going to pause the recording. The breakout rooms are closing in the next 40 seconds. So we're going to have people trickling in over the next minute, and then we'll be getting started with a bit of a deep dive into Improvement Cymru's journey so far. If you're off mute, if you could pop yourself back on mute, that would be fab. Thank you so much. And as always, if there's any reflections or things you want to share from those conversations, just pop them in the chat. Hopefully it was a nice opportunity just to connect with a couple of other people, settled into the visit today, and have a little think about the things that you'd love to learn and contribute. And I'm going to hand over now to Dom and Felicity, who are going to be telling us a little bit about their journey so far, some of their challenges and opportunities along the way. If you're just rejoining us, if you could pop yourselves back on mute, that would be fab. You can also do that and take host's privilege to mute you. So please don't be offended if we do that. It's only so we reduce the background noise a little bit. And Dom, I'm going to hand over to you.
Excellent. Thanks, Julia. Good morning, everyone. Good to see you all. And like I said, it's lovely to see some familiar faces, familiar names in the chat. Fliss and I are going to sort of lead you through a little bit about our journey. Sounds very grand. Our journey as a learning organisation, it never ends. And there's been a few bumps along the way, and we've definitely not finished it. So we're going to give you kind of some of the highlights, but also some of the lessons that we learned, which are absolutely crucial as a learning organisation, the lessons that we learned along the way, and where we've gone down maybe a few kind of dead ends, but also where we've been redirected a little bit as well by other things in the system. So, and you'll have time in breakouts to just reflect on our learning and the approach that we've used, but also recognising the amount of expertise and experience already across this group. So my name's Dom Bird. I am the Acting National Director for Quality, Safety and Improvement. So I'll talk a little bit about that. We are still Improvement Cymru, but we're also Quality, Safety and Improvement. That's one of our little detours, or our new direction, if you like, but I'll go into that shortly. And in the NHS Wales Executive. I know a few of you in the system. I've been working within Wales at national improvement level for far too long, I think, now that I think about it. It's about 20 years at a national level, but in various roles. And yeah, started as the Acting National Director in April. So Fliss is joining me today. Fliss, do you want to introduce yourself? Oh, you're on mute, Fliss. It's going to happen. Julia, I think Fliss is having difficulty.
I'm going to ask you to unmute, Fliss. Let's see if that works.
Apologies, I can't see the mute buttons when
you're sharing your screen. Sorry, Fliss.
If Julia, you can unmute me when it comes to music, that'd be great. Thank you. So hi, so I'm Felicity Hamer. I head up strategic quality and safety within the NHS Wales Executive, and I've worked in Improvement Cymru for a number of years and worked closely with Dom over that time as well. So nice to see you all. Right, I'm just going to reshare my screen now and get Dom back on track. Sorry.
Brilliant, thanks, Fliss. So Improvement Cymru, many of you will have known our story potentially. We've been partners and working closely with Q for a number of years. And as you see in my little summary there, we're now Quality, Safety and Improvement. So in April, we have moved into the NHS Executive. So NHS Wales Executive, it brings together national quality planning, quality improvement, quality assurance functions, or national services that sit in those areas into one collective organisation. It's not really an organisation, but it's a hybrid organisation to basically help maximise the opportunities to work across the QMS across Wales. So you can see there's a bit of potential there. So Fliss, can you go on to the next slide for me? That's still showing the slide layout.
Apologies, I've got to start again with this because it's done something strange.
No worries.
Right. Right. Are we where we need to be?
Yeah, yeah. If you move on one slide, that would be perfect.
Thank you.
Fliss.
Sorry, John. There we are.
So as Improvement Cymru and now as Quality, Safety and Improvement, our mission, our aim hasn't really changed. We are still the National Improvement Service for NHS Wales, and our aim is to enable health and care to continuously, reliably and sustainably improve the quality and safety of care. Our vision is very much refocused now that the whole of NHS Wales operates as a learning system. This is built off a lot of the work that we have done through using QMS and investigating and looking at high-performing organisations and how they operate as learning systems. And Fliss will give you a bit of background around that shortly. And we, as I say, moving into the NHS Wales executive, it's very much about having that national voice across all of those elements of the quality management system to help drive improvements and reduce variation. Thanks, Fliss. You can move on again. So what we do, who we work with, our core partners, ultimately people lived and learned experience. As I mentioned, we've got other directorates across the NHS executive. We have national networks, which are like our quality planning, and national strategic programs, which kind of take those quality plans into that operational space. We have our quality assurance team, performance and assurance team we work closely with, and then we bridge that gap into improvement, but also focusing on our own QMS system internally. Obviously, we still work very closely with health boards and trusts, and we've got great connections, which is fantastic to see everybody today across the UK, and we work very closely with our Welsh Government colleagues as well. And we have also focused on who our core customers are. So the system, people with lived and learned experiences. A lot of our time previously have been working with managers, clinicians and frontline staff, and our work looking at quality management systems actually brought that up into executive teams, organisations, and actually regional, but also now on that national, looking at how do you connect the parts of the system together rather than working within organisations or within teams as well. So trying to build all those connections together. For this year and for about the next 2 to 3 years, we've got some high-level priorities that we are working collectively across NHS Wales Executive. I thought it'd be just helpful to share those with people if they want to link up with us on any of these areas. Our duty of quality, which Fliss will talk about, very much is about how do you embed quality in throughout all your systems and link obviously very closely to quality management systems. We have our maternal neonatal patient safety programme, cancer pathway support as well, looking at early diagnosis, mental health patient safety, which is focusing on inpatient safety in its first elements, dementia across the whole of the dementia care pathway, our learning disability programme, which is vast across all of aspects, and that is looking at how does it redefine into a quality management system approach as well. And we also have starting off our national safety strategy, and our phase 1 this year will be focusing on deconditioning, deterioration and HCAI as well. As you can imagine, the system in which we work as well, we also offer quite a significant amount of intensive support to organisations and to health boards and trusts. And that collective response across the NHS Wales Executive has been really powerful in that areas. We as a team have a significant part of our work is around enabling. So in that improvement space, obviously still the capability building. Communications and engagement is very much focused around engagement and using behaviour change approaches. And we're linking that very closely with improvement to how do you build improvement through that behaviour change, because they're very fundamentally connected together. As well as we look at benefits realisation, obviously a key aspect of improvement around measurement. And we also have our QLab Cymru team that work very closely with complex areas of work, so looking through development phases. So if people want to connect with our QLab Cymru team, please do reach out as well. So I'm going to hand back over to Fliss now, who's going to take us through a bit of the background. So you know kind of who we are, and this will take us into why did we start here, and what was the research and what was our findings. Over to you, Fliss.
Great, thanks, Dom. So as Dom's mentioned, Improvement Cymru's done a fair amount of research into quality management systems, particularly over the last 4 years. And in that time, we've learned a huge amount from high-performing organisations and from our own implementation. So it's great to be able to share that with you today. So back in sort of the latter part of 2019, Improvement Cymru began to recognise that whilst projects and programmes were achieving improvements, the transformation of complex adaptive systems would require a bit more of a focus more broadly on quality in its entirety, not just quality improvement. And I think kind of that's been recognised quite recently, that kind of thinking in a piece that was shared by Keda Mate, so the Chief Exec and President of IHI back in 2023 at the IHI National Forum, where he outlined 4 ages of quality. So starting with that alignment with standards and the achievement of basic minimum standards in healthcare, moving to the next stage of evidence and measurement, and really ensuring that what we provide is evidence-based care. And then that shift to that 3rd phase of collaborative improvement, where we accelerate improvement in quality by working together. And then that 4th age of quality around true systemness and embedded quality, where we can scale, spread and sustain. And so for us back in 2019, we very much felt that we were in that kind of 3rd age, that collaborative improvement, very much working on accelerating improvement by working together. I think that's probably where a lot of organisations were at that time as well, but starting to recognise that we needed to shift and move into that 4th age. So at that time, quite a few UK and international organisations and groups were thinking about quality and beginning to gain momentum. And so there was papers such as IHI's Sustain and Improvement, East London Foundation Trust's How to Move Beyond Quality Improvement projects, and Healthcare Improvement Scotland's Quality Management System 90-day innovation cycle. So everyone was starting to get this sense that actually we needed to move towards this broad quality focus. And we were particularly interested in this, but really wanted to learn about implementation and to sort of answer that question, by what method? So we refamiliarized ourselves with some of the gurus in the quality management literature and the core theories. So a lot of you will be familiar with these. So W. Edwards Deming, particularly renowned in the quality management space for the 14 points for management, the chain reaction, and also kind of really very much a focus on a reduction in process variation and ensuring process control and the use of the plan, do, check, act cycle. And then Joseph M. Duran, very much recognised and renowned for the Duran trilogy and the focus on quality improvement, quality planning and quality control. But really looking at quality as a business function and something that can be managed. And then also renowned for the Pareto principle in terms of 20% of causes tend to result in 80% of the effects. So we did a lot of delving into the theory and the literature, recognise some similarities across these theories. But what we found was actually we were still looking for where sort of this theory had been implemented practically within healthcare. So we decided to do some research of our own into how high-performing health and care organisations manage for quality. So we used the 90-day cycle methodology from the Carnegie Foundation, and I think it's also adopted by IHI, to determine how high-performing organisations manage for quality. So trying to understand the barriers and the enablers, the role of the board, and the methodology that they use to implement that quality-driven approach. So we started with 483 articles, screened down to 40, covering 21 organisations, and then had the opportunity to delve a bit deeper with 15 expert interviews and 14 international case studies. And this was covering organisations such as East London Foundation Trust, Cincinnati Children's, Yon Shipping, Virginia Mason, the Mayo Clinic, and conversations with experts such as Maureen Bisignano and also leaders from across the 4 nations in this space. So we did very thorough research in this space and drew all together the recommendations. And what we found was there were some high-level universal kind of findings across all of the conversations in the literature. So in high-performing organisations that manage quality, it's a long journey, it isn't easy, and failure is inevitable. So I guess this was just very much, a lot of the people we spoke to said it's a 10-year journey, really. This takes a long time to really get that whole systemic approach to quality and to start seeing kind of the impact of that quality management system. You may see it in pockets earlier, but really to get this fully functioning, it's around a 10-year journey. And then to choose one system-wide approach and stick to it. So there were a couple of different approaches used across the research, but regardless, everyone was very much committed. Once you've chosen one, commit to it and stick to it. And then equally, focusing on managing quality can be triggered by external or an internal trigger, but must be led by the chief exec and board. And it also requires leadership at all levels, and continuity of leadership is key. And then the notion that quality is managed by viewing the organisation as a system, it's not a directorate. And this was really important at the time because a few organisations were starting to create their own quality departments. And this was very much coming through the research that actually we really need to ensure that quality is owned by everyone across the organisation. And the only way to achieve quality is really by focusing on the organisation as a whole system and how all the different pieces connect and interlink. And then quality planning, quality control, and quality improvement were recognised terms, but also needed to include quality assurance for complex healthcare organisations. And then recognising that quality control is a function of the front line and leadership more predominantly in the quality improvement and quality planning space linked to assurance. And then finally, the need for openness and transparency with time series data. And I'm sure that's music to the ears of some of the people on the call here I've seen who are operating in the improvement space. It's very much use of data for learning, not judgment. So we were also really keen to understand from the research, what is the impact of managing for quality and in terms of outcomes and outputs that can be achieved. So some of the core headlines in this space were a reliable system that places the needs of citizens and staff at its core, improvements in the quadruple aim and a focus on measurable results, an understanding of the current system with clearly defined work and processes, improved organisation reputation, becoming a place where people want to be cared for and want to work, a shared focus and purpose on the common vision and mission, where people can challenge legacy work, identify misaligned activities and understand what is expected of them and have role clarity. A culture of safety underpinned by predictability and reliability in the system that enables prioritisation, learning and robust process improvement. And a stronger relationship between the executive and frontline staff and ownership of quality at every level, generated through common ambition, transparency and visibility, improved experience and support for the right work. So for us reading this sounded sort of like the business case for why you really, really needed to focus on managing for quality as an organisation. And there were key themes coming through in terms of a focus on not only citizens and service users, but very much on staff in terms of experience and outcomes, a reduction in variation in processes, and that unity of purpose and people around a true north. So we've got a bit more detail to support those high-level findings in terms of the key attributes that came through and listed against these as some of the names of the organisations where it came through very strongly. I'm mindful of time, so I'm not going to go through all of these in detail, but they will be in the slide pack then for you to peruse at your leisure. So all of that research resulted in our QMS framework for NHS Wales, which is defined as a strategic system-wide approach to achieve the quadruple aim and embed the values of NHS Wales by planning and managing quality-driven services to meet the needs of our citizens and stakeholders. And you can see we've put the quadruple aim as it was then at the centre, and we've recognised the importance of the Duran trilogy along with quality assurance, and drawn in key enablers that we recognise through that research. We also included the need for a method for managing quality, as this was a particular point that came through the research. So we created our own definitions of quality planning, quality improvement, quality control, and quality assurance. And these are very much grounded in, obviously, all of the theory of Duran, and then all of the work that had come through the research. What we wanted to do was provide a standardised approach for NHS Wales, and also sort of contextualisation for healthcare organisations. And then we realised that we needed to expand and provide some detail around those enablers, recognising that a simple focus on QI, QP, QC and QA would not be sufficient in itself. So we grouped these as knowledge, skills and infrastructure. So having a clear organisational development strategy that focuses on improvement and system expertise. So this was kind of thinking of things, knowledge and skills in measurement and improvement, and an understanding of how the organisation works and how work gets done, and appreciating the different skills required at different levels within the organisation. And then in terms of infrastructure, thinking about things such as daily management systems, an organisation-wide approach to improvement, and a tiered measurement system. And then a grouping of leadership, culture and behaviours focused on creating the conditions for a learning and improvement environment that supports and enables staff. It's very much here thinking about leadership that is visible and consistent and models behaviour, and a culture that's focused on the vision and aims of the organisation and integrating those into daily work. And then behaviours that focus on system issues rather than people issues, and value listening to and involving staff and patients. So then, and there's lots more underneath all of these, but as I say, very mindful to just give you an overview of the research and the findings at this time. But one of the key points that we do want to drill down to for the rest of our time is the method for managing quality. So this method for enabling the systematic application of the framework, and a method for truly managing quality in an organisation. So we identified a methodology that was most frequently mentioned by interview participants, and it's called Quality as a Business Strategy, and was then renamed as Quality as an Organisational Strategy, also known as QOS for short. So QOS has been used by organisations involved in pursuing perfection a number of years ago, and also by organisations to win quality awards, such as the Baldrige Award in America. And as you can see, it comprises 5 key activities for leaders. And essentially, it offers an operating system for an organisation to embed quality. It provides alignment of the organisation to a common purpose based on an understanding of the need of the community, and planning improvement efforts to match that need. And you can see on here, so this is from the Associates in Process Improvement, and it's also based in and grounded in Deming's chain reaction and a lot of the thinking from Deming. So we had our research, our framework and our methodology, and then COVID hit, which paused any publication or implementation at that time. It did, however, mean that the research was timely in the health and care policy landscape in Wales. So this is sort of looking at early 2020 at this point. We had the Health and Social Care Quality and Engagement Wales Act became law in 2020 and came into force in 2023. And the Act comprises 4 key components, one of which is the duty of quality. And we were asked to write the guidance for the duty of quality, and so all of the research fed into this guidance. So Don briefly mentioned the duty earlier. It provides a standardised definition of quality as continuously, reliably and sustainably meeting the needs of the population that we serve, which it includes STEEP, but it moves to a systemic focus on need, which was quite a shift really in thinking, and certainly in that definition. And it predominantly seeks to achieve a system-wide approach to quality, with quality-driven decision-making at the heart of all NHS organisations and ministerial decision-making. It requires organisations to produce an annual quality report and always-on reporting. It also created new quality standards that replace the previous health and care standards. And these quality standards are based largely on the research, and they're the wheel you can see on the slide now. So with STEEP in the inner circle, and then the slight adaptation of the enablers in the outer circle to then come together with STEEP to form those quality standards. And then also the duty requires organisations to implement a quality management system. So as a result of that policy context then as well, we have just updated our QMS framework for a more simple definition. It's an operating framework to continuously, reliably and sustainably meet the needs of the population that we serve. It has STEEP at the core to align with the quality standards, and also because there's going to be a quality outcomes framework that is developed within NHS Wales, which will have STEEP at its centre. And then you can see a slight adaptation, as I've mentioned, around the enablers, just so that they align to the quality standards as they are now in the duty of quality. So before we go into detail on how we've used the framework and particularly the methodology, we'd like to hand over to you for a breakout session to share your experiences, and I'll hand over to Julia now. Thanks.
Back, everybody. Welcome back, welcome back. Hopefully that was a nice chance just to have, again, some small conversations about your own journeys, your starting points, some of the challenges and enablers that you are thinking about and working on. If you've come back in, do pop yourself back on mute. We're just going to do a couple of quick questions before we go on a break in 5 minutes. There are some interesting ones in the chat. And of course, if something came up for you in that breakout room, do add a reflection or an insight or a question in the chat. But Felicity, Dom and the team, I wonder if there's any in there which you would like to start with. There was one from Jem around the most significant gaps from where you're starting the journey, and one from Karen on kind of organizations and systems integration, really interesting reflection on kind of where in the system at the organizational level the QMS sits, really. So I don't know which one you'd like to take first.
So can I take the one about the gaps? And this may not be the kind of gaps in the what we have found, and you'll see a bit later on, is in a most systems have got a bit of the quality planning, the improvement. It's how they connect together, and that seemed to be the biggest areas of learning. It's actually how do you connect those pieces together. As a leader, one of my kind of, I guess the biggest learning point for me was how do we stop operating in silos? And that was probably our biggest gap as well. We thought we were operating as a system, but we were still operating in silos and considering work in silos. And I think that's been the biggest change that I've seen in, and that's not completed. It's not done. It's a habit and a behavior I think we need to be really mindful of and continually keep an eye on. But that was for me. Fliss, I don't know about you.
Yeah, thanks, Tom. Completely agree. And I think there's something around the understanding and appreciation of quality planning, etc. And I think for us, certainly in Wales, there's kind of a view that quality planning was just good planning. And actually, it's not. It's so much more. It's that connection to understanding what you should be doing, the need, the correct products and services you need to be focusing on, and then the processes that underpin to identify those really significant improvements that you need to make. And I think for us, that was quite a big shift in time in terms of moving to that quality planning space. And then also a bit of a blurring around the understanding around quality control and quality assurance, and also quality control and quality improvement, and just trying to tease that out a bit with organizations and with individuals, I think has been probably a bit of the kind of work that we've needed to do at the start with it, and really needed to tease out.
And that's something, I mean, there's a few more reflections in the chat. I could see one from Matthew Nielsen about the definitions and some of those distinctions, which may resonate with what you're reflecting on there, you know, the debates it can lead to and the importance of those definitions and distinctions. Yes, there's another one, there's another couple in there. I wonder if you want to just take a moment. We've got another couple of minutes before we go into break. Is there another one you might want to pick up on?
I've just reading through, I could see the comment really from Andrew talking about the cult, and there is something about language in all of this. And, you know, I find even with what I just said now about talking about quality planning, etc., we really do need to keep this simple. And Don will also share in a minute, you know, we sort of, in our first round with this, we gave the approach a name, it got an identity, etc. And that's not the way to do it. We learned that quickly. So our second round, we stripped away from that. This is about integrating good practice, good understanding of your organization into everyday work and making it just how things are done. So I think absolutely there's trying to weave some of these core principles into everyday work and priorities and principles that are already happening, as opposed to creating this big separate thing and identity. So 100% agree on that one.
There are some interest, there's loads of questions coming in now, which is great. And we may need to park some of them for the Q&A session we've got later, which we have got a bit more time to go into these. But yeah, some interesting reflection on from Femi, how did you integrate existing QA system functions with your quality management system? Another one from Matthew around patients or people using services, how do they fit into the QMS? The idea of the board, that you mentioned the board early on in the presentation, what's the role of the board now in your approach, and are there any individual board member roles? How's that evolved over time? And then there was that point earlier from Karen, I think, which was, is the organizational QMS, individual organization QMS, the way to go when we need to embed truly integrated health services? So lots of interesting questions. I think we should hold on to those and come back to them potentially after the break. It's probably time to give you all a moment just to step away from the screen, refresh your drinks, have a quick comfort break, and then we will hold on to those questions and come back to them. Don't worry, we won't lose them. And if there are more, please take a moment now to pop them into the chat. We're going to take 10 minutes as a break, pardon me. Feel free to go off camera, on mute, and when we come back, we're going to go into a little bit more detail. So we will see you in 10 minutes. And when you next hear my voice, that's your call to come back on screen and we can go into the next part of the visit. So see you shortly.
Yeah, sure. So there's a couple of bits that came up in the chat, which hopefully I'm going to thread through this next session, because this next section, because this will take through to where we started in Improvement Cymru. So as a reminder, Fliss, you can go on to the next slide. This is the method that we took and we tested internally through those 5 key activities. And the first activity purpose, if you leave it on this slide for a minute, Fliss, the first activity purpose starts further back than that. So it's not even purpose. It starts off with what is the need in the system that you are meeting. That is a really difficult conversation to have. It took a long time to properly nail down and agree as a leadership team. What is the need? The need in the system, according to this approach, the need doesn't change. Your whole system is set up to meet that need. So what is that never-changing need? And this picks up some of the things that I think were mentioned in the chat around how do we engage with service users, how do we get their voice into this? Because it should all be focused around that need and understanding what that need is. Now, we are an improvement organisation for NHS Wales. We were at this stage, we're now a quality safety improvement organisation, but we can go into the namings and the technicalities of that later if we need to. We're an improvement organisation for NHS Wales. So the need within the system is actually for the health boards and trusts. They are the customers, if you like, of our system. And that was a difficult conversation to have as well as leadership. And we never had these conversations before, I think, in this depth. So when we look at the need that we say that we were there to meet, and what we landed on, if you like, was to support the system to continuously develop its capacity, capability, and what we meant by that, knowledge, structures and methods, to improve the quality and safety of health and care services in Wales. So that gave us almost a grounding of, right, this is the need that we're meeting in the system. And we can always then check back to, is this actually meeting the need in the system, or are we going off track potentially? Another aspect that came up in the chat was around definitions. And this was a key aspect within this first phase. So if Fliss, if you can take us through to the next slide in that. Our first activity was around purpose. And as I say, we started with We went through a very linear approach here, and we started with purpose. We started with our need, and then we had to start defining, what do we mean by that? So this is the purpose that we developed with our team. As you can, some of you who've got really sharp eyes will note this is slightly changed from the purpose that I mentioned at the beginning. That is because we're now quality, safety and improvement in the NHS executive. So we are constantly iterating this and going through these processes again and again, the activities again and again to build on. And we've always taken the approach that when it's good enough, we use it and then we iterate it and iterate it. We're not looking for perfection in every stage. So we, as the original Improvement Cymru, this was our purpose statement. And then we had the discussions, okay, well, what do we mean, create the conditions? What does that mean? What does health and care system mean? Or what does that mean we're working with care homes? Do we work with social care? Do we work with local authority? What are the boundaries? And so a lot of our time in that initial phases was around defining operational definitions of elements of our purpose, so that we as a shared leadership team had a complete shared understanding. Too often we had seen, and we had that as experience previously, we'd have our purpose, yeah, brilliant. And then could anybody actually use it? Could you actually quote any of it? Could you remember any of it? Could you define it? And if you had 5 members of the leadership team, would they all say the same thing as to what we meant by building capability or creating the conditions? So we spent time as a leadership team, but also with our senior leaders as well, is creating operational definitions for each of those elements. And I'm going to use a horrible American phrase here, but it comes through in the QBS books, is using these as artifacts. So the purpose statement is considered one of our artifacts. And how do we use it? So do we use that in decision making? So if we're in leadership team meetings and we've got to make decisions on resources, allocation, or etc., or business cases, etc., using our purpose statement. Is this meeting our purpose statements? Is this therefore going to meet our need? And it's how we started using those through our work. So we started with our purpose statement and the work to define that. And that took us now into a next level in that activity, which was our products and services. So, okay, we have our overall need was good enough. We've got our purpose statement good enough. What are the products and services that we have as a system, that we offer as a system, that help us meet our purpose, that help us meet that need? And getting, again, shared understanding, definitions. What do these actually mean? We mapped out all of the work that we did and looked at our purpose and looked at the need, and then mapped across, well, are these, and if they're not, why not? Are we going down a different route? There's something that's not getting us quite to where we think. And then helped define these. We are iterating these continually. So we are constantly looking back at these and refining them and seeing how we understand them. And it's getting that depth of reducing the variation as well in approaches, understanding, but also ensuring that we are improving our system continually. Once we had those, we went into our second activity, which was to look at how do we operate as a system. Now, this is going to look incredibly busy, and the detail in those boxes doesn't matter to anybody else that doesn't work in Improvement Cymru, because it's not your system. But what I will go through is uses the QoS approach in considering a system as 3 key elements containing driver processes, which you'll see at the top in purple, the mainstay processes in blue, and I'll come to the white bits in a moment, and then the support processes in red at the bottom. And one of the key aspects we had to overcome, I think, in a leadership team is looking at these, is this is not hierarchical. This is how we work as a system. So our support processes are just as important as our mainstay processes and our driver processes. The language can be a bit of a barrier there, but all of these are so interconnected, and all of them help us achieve our overall purpose and deliver for the need to meet the need. So I am going to give you some quick definitions of these. So the drivers at the top, the purple, these are what prepare us to meet our customer need. So these can be things like strategic planning. These are where you would hear about the system. What are the customers saying? What's your research saying? What's your plans to improve? What's your market research? What's your system informing you? So it's all about that advisory piece, thought leadership, information collection systems, bringing all that quality planning piece in, if you like, and then building that round into the mainstays. The mainstays, the blue in the center, are what we actually do to meet our customer needs. So these are all the products and services that meet the needs of our customers, which are the health boards and trusts in the system. And our support services are then everything that helps us meet that customer needs. So these could be recruitment, budget management, comms, PMO, IT, workforce development, etc., etc. And it took us quite a number of iterations to map out what we looked like as a system, and we are still continually iterating them. The boxes in white are the things that we need more development in. So we started identifying as we were mapping through, we kind of think we've got something here, but I don't think we've got a robust process, a standard approach. We need more development in that space. So we started iterating and building and already identifying the variation as we built out our system. And it helped us see how everything is so interconnected. It helped teams see if we started mapping leadership responsibilities. So our leadership team mapping our responsibilities, and they're all over the place. So that helped break down some of that silo working. And you can see that with our teams as well, and with our leads, when we map through, if we take the next slide, Fliss, we mapped a piece of a program of our work through that system map. And the collective responsibility to deliver that program of work became really clear, and clear not just to us, the leadership, but to the whole team. And that is where the early stages, when I was talking about breaking down silo working and that silo mentality, this is what really was the game changer, mapping out as a system what all of our work looks like and how interconnected it is and how interdependent it is. And I know a number of you have worked with systems thinking, and it can be a real game changer when you get to that stage. So that was our second activity, and the artifacts themselves look fairly simplistic, but it takes a lot of work and a lot of conversations to get there, and the value is in those conversations and those debates. This helped us then identify areas for improvement. So rather than looking at areas that we had potentially had come up through business cases or other aspects, it really brought to the fore there's some key areas that we needed to improve as a system. So for us internally, there was something about SharePoint. You can see some of the high level ones there. Staff wellbeing engagement, how do we progress report our improvements, our collaborative itself, and also our requests of support. So intensive support was becoming a new process that we needed to absolutely bottom out. So we then went into that activity about how do we start managing our improvement efforts internally within Improvement Cymru. What's the next slide then? Thanks, please. So I think that's a really high level. There is a massive book, a guide that supports the QoS. It is quite a tome, and there's a number of activities through so in the purpose section, there are a number of exercises through there, and we went through almost every single exercise. So defining, taking your purpose statement, using it in meetings, how much of your conversations are actually based on that. With our system map, I had my system map next to me for months, basically every single meeting, jotting down, scribbling, where am I on the map in this meeting? Which bit am I talking about? How interconnected is that? Am I missing something? So we were constantly able to iterate it by using those products. We did a lot of analysis on where am I spending most of my time? So across the leadership team, we did time and motion studies around our system maps and worked out where are we spending most of our time? Is that where we should be spending most of our time in meetings and discussions, or actually does that give us an indication that there's something in that part of the system that we need to improve? So it helped us starting to understand a bit more and open a bit of a Pandora's box in there. They are really incredibly helpful exercises. What we have learned, I mean, we went through it in a very linear fashion, but actually we are now going around that again. We haven't got through all of the activities and completed them all because we are now moved, as I mentioned earlier, into a new organisation. We have to revisit some of these. But what we are doing now is actually using that method again, iterating further and working deeper within our teams and our wider organisation as well. I've mentioned already, use the stuff's good enough. So as soon as we had something that was good enough, when we started using it, and as I say, sat there with the system map, scribbling on it, saying, oh, I've just had a conversation about this product, it's not on this list, or this process, we haven't captured that. So starting to iterate that as we go and using it. And it does really, an adaptation of those does actually bring together the Deming and Duran aspects as well. Thank you, Chris.
Oh, just while we're on a moment of pause, and I'm about to do the video, aren't I, Fliss?
Yeah.
So just a couple of, if you could click hide when you start sharing. I think there's a little pop-up that has been covering up some of the text, not loads of it, but if when we reshare the slides, you could click hide on that pop-up, that'd be fab. And if you want to stop sharing now, I will share this video, and let's keep our fingers crossed that the audio and video work. So I'm going to.
So Julia, shall I, Fliss, do you want to introduce the video? Because this kind of moves from our test in Improvement Cymru into a wider area.
Yeah, sure. Thank you. So as Dom's just kindly described, that's our work in Improvement Cymru and within QS&I now more broadly. What we were fortunate to be able to do and have the opportunity to do is to then work with Public Health Wales more broadly to apply the methodology, but to do it in a more agile way, I'd say, integrating the principles into existing priorities and ways of working, complemented by and aligned to the organisation's work on culture. So we've got a video that Wayne Jepson, Head of Quality Engagement and Collaboration, has kindly developed for us to share more about the approach in Public Health Wales. And I think Wayne is also on this call this morning as well. So thank you, Wayne. And over to you, Julia.
Indeed, thank you, Wayne. And there are some more fantastic questions in the chat if you want to have a look in there. Let me just share my screen and bring this video up. And if you're off mute, if you could just mute yourselves, that help. Actually, I need to do that again so that I'm optimizing for video and audio. Yeah, if anyone's off mute, if you could just go on mute.
Hi, my name's Wayne Jepson. I'm Head of Quality Engagement Collaboration in Public Health Wales. So today I'm just going to talk to you a little bit about quality management system journey in Public Health Wales. We are at a kind of foundation stage, building on that in the early building blocks. I'll focus briefly on 4 elements of quality management system and just try to provide a kind of insight and glimpse into the approach we're taking. So if we move to quality planning, the first element, we know that kind of the approach around quality planning is understanding the needs of the population, the customer or the service user. It's about trying to utilise the evidence and the best practice across the organisation to optimise outcomes. And it helps to set goals through understanding needs and desires through a quality lens. And it obviously forms part of the annual planning cycle. In terms of in Public Health Wales, we're in the process of strengthening the alignment to our organisational planning cycle. So we're ensuring that the quality planning is informed by evidence, data and quality standards. The quality planning approach then informs our Tier 1 areas for improvement. And our Tier 1 areas for improvement are those that align to our strategic priorities. Next element, quality control. So this incorporates good operational management, monitoring performance in real time, taking control when needed, and that rapid escalation if so required. Quality control should be owned by the team or the service, so not just at a very high level, right down to that operational level. In Public Health Wales, we're working collaboratively across the organisation to strengthen our visual management system so that we have a transparent display of key metrics for services and functions. Linked to this is the ongoing development of our Civica system, which is our central system for capturing and analysing the feedback and experiences of the people we work with and for. So a robust quality control approach where we have opportunities to focus on data and take action is a key ingredient within a strong quality planning approach. Moving on to quality improvement. The approach is a systematic and applied approach to solving complex issues with those closest to the issue. So it's about reducing that unwarranted variation, reliable implementation of interventions and discovering new solutions through the process of innovation. It's about embedding the approach into the organisational culture also, using the quality improvement capacity where it will achieve the greatest return. Our Improvement and Innovation Hub is a 3-tier approach to improvement support across the organisation. The tiered support ranges from the improvement projects that are aligned to the Public Health Wales strategic priorities, right down through to the improvement efforts at team and individual level. The key to support at any of the levels is that it focuses on results-driven improvement. The Improvement Innovation Hub is developing a systematic approach to managing quality that includes building improvement capability to ensure teams at each level of the organisation have the general and specialist improvement skills needed. And then finally, onto quality assurance. We know it's a key mechanism for improving quality. It's about having those periodically checking that we are meeting standards. Obviously, assurance helps ensure we are meeting standards, and it's not a mechanism to just improve performance. Innovation and creativity is also required to discover new practice, and this can obviously help with behavioural change as well. In Public Health Wales, while we do have robust quality assurance processes and systems across the organisation, we are strengthening this through implementing a quality oversight group. This group is organisation-wide and is in the space between board and committee level and then the operational level. So the role of this group is not only to provide quality assurance, but also advise, provide clear and consistent strategic direction, leadership, demonstrate and share improvements and learning, and ensure transparent lines of accountability. The duty of quality has played a key part in developing our quality assurance processes and systems. Whilst we're in the foundations of our quality management system journey, I hope that this has provided an insight into our direction of travel. Thank you.
Fab. Thank you so much, Wayne. Back to you, Dom and Felicity. I think there's a few more slides before we get into that breakout, isn't there?
Yes, there is, and it's over to me now. So, yeah, it was, and just to clarify, I think probably
frozen.
Froze. I think Fliss froze there. I'll pick up a couple of the questions from the chat whilst we wait for Fliss to reconnect. So
use of QOS at a direct, apply that learning at an organisation level across the whole of Public Health Wales.
Oh no!
Got the snippet from her, but she'll be back shortly.
Yes.
So there was 5 bits that I've spotted in the chat. There was one around the role of board. I think it's absolutely crucial. So for people to understand, the Improvement Cymru, we are part of Public Health Wales. So we were looking at our part of the system initially, and then we've been supporting Public Health Wales as an entire organisation. And it was absolutely crucial, as Wayne mentioned there, that the role of the board and the engagement of the board and the leadership of the board throughout this journey was absolutely fundamental. I will link that to the comment around the system map. So really interesting, but terrifying when you think of the size of organisations. It's the level at which you go at. So Public Health Wales have developed a system map around their organisation and mapping and identifying those opportunities to connect together. So you don't have to go right down into the detail. And I've seen, I think Jonchapin has done the same. And also there's some ambulance services within America that have done the same as well. I've seen some in other systems as well that we can probably link to in the resources. So we're going to share out after today, obviously the slide deck, but a link of further reading and other resources. We'll include the link to the QBS book that I mentioned previously as well. We did work with partners who helped us through the early stages of this around the QBS approach, and Fliss was going to start taking us through the iteration. So as we built on that and moved that forward in our next section. And then the last bit that I wanted to pick up from the chat was its relation to human learning systems. So I see this as multiple levels. It's the same principles that people are taking and adapting. Is how do you understand the need? How do you listen to that voice? How do you map your system, connect those pieces together and continually improve? And sometimes I find I simplify things maybe a little too much, but kind of that's my way of thinking. So if you think about a learning system on a ward, you could have exactly the same with visual management. How are they learning? What's their planning? What's their improvements? How does that come together? And how do you connect that through that organisation? And this is where we're working with a number of health boards now in mapping that through.
Thanks, Dom. I have no idea what happened then.
Oh, phew, thank goodness you're back.
I don't know what's going on with my tech today. I know there's a little bit of my own ability, certainly with the slide sharing, but the internet and the power of that is beyond me. But yeah, I'll move us on to our next section now. Thank you.
Brilliant, thanks, Liz.
Okay, great, thanks. So as Dom's just mentioned, a lot of this kind of overlaps with so many other approaches out there, and a lot of it arguably can be seen as common sense, but we often find that sometimes it's really nice just to have a method and series of steps to work through. So we're often asked, and indeed on this call have been, where to start. And so we developed our own sort of 6 Ps to build a quality management system. And this is adapted from a book that we would recommend, and we'll put it in the pack for after this session as well. So transforming healthcare leadership. And so really what we're looking at is how you build your quality management system and look at the systems, processes and infrastructure that you already have, but kind of work through it methodically and look at where you need those connections, where you need to build out and where you need to kind of bolster some of the processes. So this is very much about fundamentally starting with understanding the big picture, beginning with the point of view of understanding the landscape. What is going on out there? What are those with lived and learned experience telling you? What is going on in the internal and the external environment, and really, really understanding your environment and listening to that feedback. And then from that feedback, really determining need and understanding your true north, your purpose. Why you do what you do, who you're in service of, and the behaviours and values then that underpin the work that you do. So just ensuring that focus on, as I say, big picture, purpose and practical values. And then moving on to understanding what you actually deliver, the products and services that help you achieve that purpose, and then identifying the key ones that potentially need to be designed or redesigned to help you achieve that purpose, and really helping expand and focus then that quality planning aspect. And then really looking to understand, once you're clear on those products and services, what are the processes that you need to achieve those products and services, and to ensure that your system is truly effective, and focusing on then the 20% of processes that will really, really help us accomplish our purpose and potentially need that design or redesign. And then finally, really important, thinking about the people within your quality management system and the capacity and capabilities that's needed within your workforce, and the support that they need and the culture around them to really ensure that your quality management system is efficient, effective, and also enables a place to work that people want to work in. So those are our 6 Ps in terms of steps to work through to build that quality management system, drawing in obviously parts of your organisation and processes that already exist. And then what we've developed is our method. So building off that one that Dom has just talked you through in terms of quality as an organisational strategy, trying to simplify it a bit, if I'm honest, and trying to really focus and show those connections between those core pieces. And for us, building on all of our experience, really putting a feedback system at the heart there. You can see in the middle, number 1, just understanding that core to the methods, a clear and effective feedback system that provides a system to horizon scan, to generate insights, and to really ensure that the organisation is clear on what it needs to respond to with quality planning. And that, in terms of that feedback system, I guess it can include policy context, population needs, current organisational performance, as well as any sort of foreseen challenges on the horizon. And what you can see here in this model is really that the connections and the arrows are really, really key, is the linkages and the continual use of feedback that enable the operating model to put quality at the core. And just to confirm, the model can be used at whole organisation, directorate or ward level. It's been used at ward level. We've used it as Improvement Cymru now, moving into QS&I directorate level, and used it within Public Health Wales at whole organisation level, and we'll be using it with other organisations in NHS Wales as well. And just to give you a little bit of detail in terms of the colour coding. So in the pink, it's the parts that focus on purpose. The kind of turquoise colour is planning and delivery of products and services. And then the green are the measures that operate at the front line for processes, products and services, and then also at organisational level in that quality assurance space. And that's really those system level measures mapped to purpose, and really ensuring that it's the right information to have in that assurance space for your board and for external assurance. And there was a point earlier about the quality assurance, and we've mapped in all of the existing assurance mechanisms, but I'd say probably our organisations are sometimes overburdened with quality assurance mechanisms. So some of this work has really been around stripping some of that out, simplifying it, and really focusing on what you need to be assured of against your purpose, and maybe stripping out some of the noise and some of the measures that aren't suitable at that level and can be reported at a different level. And then moving to the purple on the map, this is really about the improvement efforts. So tiered to reflect those that can be done at project, directorate or system level, and including those with lived and learned experience wherever possible. So you can also see the numbering on this diagram, and the numbers relate to key questions to ask at these specific points. And I appreciate this is kind of quite a lot of information to take in a short space of time, but the numbers really help you work your way through that map. We'd recommend that you start with number 1 in terms of that feedback system, but you can start anywhere on the map, depending on where you are within your organisation or with a particular programme or piece of work. And now I'm going to hand over to Dom to take you through an example to help bring the model to life.
Thanks, Fliss. So we're obviously going to go into breakouts shortly, and one aspect we've used to reflect on is trying to bring this to life with our leadership team, with our teams, and just test it through ourselves. Was thinking about, okay, so let's think about back when COVID struck and what happened with us as a system, so Improvement Cymru, and considered those kind of questions. So where was the information? So if we start with number 1, where were we getting that internal and external feedback? What was telling us that there was a change, that perhaps did our need adapting? Was the need changing? And therefore, would our purpose need adapting? And then takes you through that system. So where did our intelligence from COVID come from? Obviously, we were in Public Health Wales. We're getting information from our exec team that the infection was growing, that would continue to grow. The system was going to have increased admissions. There will be predictions on suspension of normal healthcare services, and now a need to refocus the whole system on a pandemic response. And that response was required across the whole of Public Health Wales, including ourselves as Improvement Cymru, mobilising all staff to this new purpose. So if we have that QMS approach, we're looking at, okay, so is the need is changing? Is our purpose therefore changing? Is it meeting the need? So as Improvement Cymru, we then felt obviously our purpose shifted from coaching improvement support to becoming part of the wider Public Health Wales response. Our priorities moved away from capacity and capability building and improvement programs to actually designing testing centres, designing an online portal for testing, which I led on, designing and redesigning labs, redesigning ports and border support, a lot of areas that we hadn't experienced anything like this before, and our ways of working weren't really set up to adjust and develop new processes that could be measured. We didn't have data to see how we were performing in some of these areas. So across PHW, we had 150 staff in our call centre, taking 40 calls a day. We hadn't had the systems built up, that feedback loop in that space to being able to redesign the processes quickly, freeing up those individuals potentially to support capacity in other areas. So a lot of these learning loops have been built through us as Public Health Wales and working with the board in reflecting, using this approach to walk through COVID and think about how do we draw out the learning from that and how do we build strength within our system. So for an example, as I mentioned, I was tasked to create the online portal for testing. But if we had really taken time to look down at our quality planning, we would have looked at the skills and capabilities required using those prompting questions and walked our way through that and deployed potentially different support in different areas. I think if we had mobile testing centres at some stages, but we didn't have necessarily sufficient data to test their effectiveness. So there's something about how we could use that as a walkthrough model as we're planning that system. We did have really strong parts of, I would say, learning systems within Improvement Cymru, but also across Public Health Wales. We did have great measures for our new labs. We could see the turnaround data where we needed to improve our performance through Cross Wales. We built in an improvement programme and reduced that turnaround time from 4 hours to 2.5 hours. We had internal parts of our internal system in Improvement Cymru had really strong feedback loops that they had already almost smaller learning systems, quality management systems developed, micro systems. So they quickly informed new products and services to set up to meet the need in the wider system, such as first of our care home Cwtch, where we partnered with Age Cymru, Social Care Wales, Digital Community Wales to develop a platform to offer peer support to care home managers through that pandemic. So there was virtual support sessions, sharing practical solutions. And that also identified further needs. So that fed into the wider system development support and that feedback loop. In addition, our learning disability team identified needs from within their feedback loops, which quickly informed developments of new products, easy read information, support for carers, and the learning disability community as well. So we could see areas on reflection of strong systems and feedback loop systems. And it's to how do we draw the learning out from there so that we can strengthen that and spread that learning across the wider system. So we have reflected that if we had our QMS operating embedded when COVID hit, we may have deployed our staff and skills differently. We would have had implemented standardized processes and measures to monitor in real time. And I think we would have spent more time looking at that purpose to reinsure ourselves and rework through our products and services to meet that need. And that may have helped to continue to avoid some of those pressures on the system post-COVID, such as the impact we've seen in such areas as mental health, for example. But that's just one example. It's our experience, and it helps to walk through the model and just think of those prompting questions. So we're going to give you a chance in your breakout groups to just have a look at the model, have a look at the prompting questions. And this may be an exercise that will work for you. So using your experience of working in an organisation during COVID, considering the model, the questions, is there anything you would have done differently? Is there anything that could have built on and drawn on? The questions further on in the slide are just some prompts, so you don't have to answer all of those. But have a discussion, explore the model, explore the questions, and reflect, and it'd be helpful to hear your reflections in, would this have helped in any way in that scenario, or if there's other reflections that you have on there. So just going to go into breakout groups now and hand you back to Julia.
Thank you so much, Dom and Felicity. Really helpful to have that practical example to bring it to life. We are going to move into some breakout groups now to give you a chance to apply that kind of model to your own work during COVID. And those prompt questions, which actually I'm going to, Vicky, could you possibly navigate to those and just reshare them for a moment? We wanted to give you, I've put an upload in the chat so you can download those questions and the model to have side by side as you go into the breakout room. So we were also going to give you couple of minutes, silent and solo, just to gather your reflections on those prompts before you go into breakout rooms to discuss them. So if we just reshare, I'll give you a moment, Vicky, to find it. And if you're struggling, let me know and I can find the right slide. But it's just a moment. Here we go.
From the slide, Julia.
Yeah, I can do it here. Here we go. Yeah, I'm
Just found
it. Don't worry. Let's give you just a minute, Silent and Solo, to have a look through those. It's an invite to for about 20 minutes in breakout rooms. Think about the model that the team have shared with you, and use your experience of working during COVID to think about those prompt questions below and what you might have done differently. So have a look at those prompts, and if there's any clarification questions, now's a chance to just clarify those. But otherwise, it's a minute or two to just reflect yourselves on those prompts, so you have a chance to gather your thoughts before we go into breakout rooms. So take a moment to gather your thoughts, reflecting on your experience working in wherever you were working during the pandemic or part of the pandemic, and thinking about that live example we've just heard from the team at Improvement Company as a way of illustrating and getting into the detail and the granularity of the model. Give you another moment while we set up some breakout rooms. And again, as before, if you would rather stay in the main room and spend some time reflecting, Silent and Solo, that's absolutely fine as well. We're going to move you into groups of about 6, I think. So you've been slightly bigger groups.
I think it might be 4s and 5.
That's
the numbers
better.
keep moving. Quite
better.
a lot of people are moving around at the moment, so I'm just
No worries, Vicky. So just going to leave this slide up for another 30 seconds so you can jot down any thoughts, and then we will open up those rooms and you'll have 20 minutes in those breakout rooms. So any final thoughts you want to jot down? It doesn't look like there's any clarification questions, so hopefully it's clear. And as I said, I've uploaded the relevant 3 slides that you might find useful to have on hand into the chat. You should be able to download those and have them alongside you in the conversation. So Vicky, are we ready to rock and roll in breakout rooms?
Give me 1 second.
Go for it.
I'm going to open them, but there might be a couple of people who aren't in them because I can't see Dom, you on this list, and I know we were going to put you in a room, so I don't know quite what's happened there. So I'm going to open them, and then if there's anybody left in the main room, I will then move you into a room.
Great.
There's a lot of movement of people and dropping in and out just now. Okay,
No
so I'm going to
worries.
open the rooms now, and if anybody's left who wants to join a room, we can do that.
So you've got 20 minutes in those breakout rooms. We'll let you know when you've got a couple of minutes left, and then we'll be moving into our final parts of the visit.
To remind you, you'll need to click join if you want to join a room.
Just people landing slowly but surely back into the main room. Lovely to see you, and hopefully that was a nice chance to go a bit more in depth into some of the big questions we've been exploring today. We've got just under 15 minutes left, and we will definitely be getting you out on time. And I just wanted to, actually, Vicky, can you spotlight me? I wanted to just check if anybody wanted to share any reflections from those breakout rooms. So we've got a couple of moments now just to hear a few voices from those conversations. No expectation that you have to, but if anybody did want to share any reflections or thoughts that are still with them, there's a couple of moments now before we go back to the team for some of their final lessons learned. Temi, come on in, yeah.
Yeah, I think it was just interesting because the scenario that you gave is something where most ways of working ended up being disrupted. And so sort of thinking about a quality management system, yes, it may be difficult to implement that, but I think the thing that I took away from it that that was kind of spotted across my examples, other people's examples, was this idea of the importance of the iterative nature of whatever it is that you're doing. So that feedback loop, like getting that feedback loop into it's like a mini QMS. So even if you're doing it day by day, right? So you get that feedback loop and then you sort of change what you're doing in terms of planning, et cetera, and you keep going. And how important that actually is, regardless of what's happening outside. So I think that was quite key. That was very good.
Thank you. And Dom, I could see you nodding viciously there. Yeah, absolutely. Mark and then David, do you want to come in and share your thoughts?
Yeah, certainly. It wasn't a competition, but I do feel I had the best breakout room by far. So just wanted to share that quickly. No, I think I just really appreciate the openness and honesty of the group as we got kind of discussing through the pandemic and how it affected us. And I think the paradigm shift in the way we work and how we had to adapt. And there's lots of kind of pressure in the system and lots of unknowns and lots of things going on. And I think it's really useful discussing how people adapted and dealt with those things, but all equally from the QMS standpoint is how we learned from those things. And how people actually were able to pause and kind of think, what can we feed forward? What didn't work so well, but what did work so well, and how can we kind of capitalize on that for the future? I just think it was really kind of really impactful sharing. I think all of us kind of opened up and offered a little bit out there, and I thought it was really, really useful discussion. So that was it from our group. Thank you.
That's really lovely to hear. Thank you, Mark. I'm so glad. I'm so glad. And David, do you want to share any reflections?
Yeah, so we had a really eclectic mix of people in the room who had such a wide range of different experiences through COVID. One of the things that we all agreed was that whatever organization we're in, our kind of need and purpose hadn't really changed. What changed was our delivery mechanisms. So the mechanism by which we were delivering that need and purpose changed significantly. And I think we were literally just touching on that importance of the feedback loop. And we were talking briefly about how our services had to redesign quite quickly, but we were also looking for the guidance. So the guidance was coming externally and we were trying to interpret it and then make it happen. And I think we were literally just talking about how we might not have had the skills and capability to do that quickly enough, and that may have caused some collateral damage along the way. And the importance of those feedback loops, I completely agree with Emmy. As somebody who worked on the wards, it was sometimes frustrating that those feedback loops weren't there, and yet in other aspects they were quite effective. And I think that was where we had some significant variation.
Lovely. Thank you, David. Dom and Felicity, I'm going to hand back to you now just for a final couple of minutes on your lessons learned and also any reflections you want to share on the conversations you've been hearing today and the questions and reflections that have come out through the chat. I'll give you just maybe 3 or 4 minutes and then we'll move into our closing stages.
Thanks, Julia. So a couple of it, I think that feedback loop is absolutely crucial, and it's where we seem to have that in pockets, and that's what we learned when we went and looked through this as Improvement Cymru and as a leadership team. We've got that in pockets. We've got that in micro levels, if you like, of our organisation, and we identify where we need to strengthen. And that, in a grand term, in the original QBS language, is the system to obtain information. So how do you, which is not only your feedback loop from the system, but it's the horizon scanning. It's how do you bring all of that information together? We've recently gone through our planning activity, which actually brought together all of our information from stuff that comes across our desk as leadership team throughout the year. So staff feedback, service user engagement and feedback, all the information from our teams and our customers out in the health boards and trusts, all our horizon scanning work, but very rarely do we look at that collectively. We don't triangulate that together to plan forward. And I think that's been quite a dramatic shift for us as well, is to look at all of that information together to help us plan forward and identify our areas for redesign and new design as well. Fliss, I didn't know if you wanted to add anything to that before we close on.
No, very happy to move on to just our key bits of learning. Mindful of getting everyone offline.
Yeah, true.
Bro, thanks.
So we've only got a couple more slides to go through, and then we'll hand back to Julia to close out the session. So just a summary from us.
Okay, so just in terms of kind of principles for QMS, appreciating the learning from our research, but also implementation within Improvement Cymru and Public Health Wales, and the conversations we're having with so many organisations at the moment, and conversations with yourselves will feed into this learning thereafter. So thank you again for all the conversation. But key points, just ensure clarity and understanding of quality control and quality assurance, and getting that distinction. Appreciating that quality control and quality planning are often where there's the greatest work to be done and the biggest impact, certainly from our experience. And that quality improvement will have the greatest impact when it's directed by quality planning and then results in sustained quality control. And as we sort of woven through the conversation today, just, you know, the language and the concepts, they can be overwhelming and confusing at times, just trying to simplify as much as possible. And just recognizing really that a lot of what we've talked about today has its foundations in management principles. So it will be familiar, and just really making sure that you find an approach, whether it's the one we've shared with you today or another one, just find that approach and method that works for you and your organization and stick with it. As we've said, it is a long journey, but just staying true to that method and working it through will really, really make a difference. And Dom, over to you.
Thanks, Liz. So we've explored, and I think we explored in the breakout groups, how you can use this at different levels. So how do you get all those different levels connected together? We took a linear process. It doesn't have to be linear, but it is often about the connectivity between those parts. And just start with what you've got. Learn and refine as what you've got. Don't go for the perfect. Because it's crucial to use what you start developing. So start small, focus in one area. Once you've got a piece together, then start using it and iterating it as quickly as you can. But it is often the connections between how does quality planning inform where your improvements are going to be alongside quality assurance. So it's thinking about those connections. And I'll stop there to make sure we get people out on time. Thanks very much. Back to you, Julia.
Thank you so much. Well, first of all, a huge thank you to you and the team for an amazing visit. It's been fantastic. You've shared so much of your journey. We just want to do two things before we let you go. One is for our own continuous improvement, a very short survey, which Vicky has just put into the link. That's our evaluation form for this visit. It would be brilliant if you could take 2 minutes now just to open that link and share your reflections. And then we're going to talk a little bit about next steps, resources that are coming out, and some of the other upcoming visits that you might be interested in. Lovely to see some appreciation coming through for you and the team in the chat. It has been absolutely fantastic hearing about your journey so far. Take a moment. I'm going to give you a minute, silent and solo, just to do that evaluation. We have learned that if we invite you to do the evaluation in the session, we get significantly better data. So we are committed to hearing how you found it and making all the tweaks we need to for next time. And then we'll just do a final wrap up and let you go by 12 on the dot, I promise. So just a moment in quiet to do the evaluation, and then we'll wrap up. And thanks, Matthew. There's a great event coming up next week, which Matthew has popped in chat, which you might be interested in if you're still keen for more QMS learning. And there's also a networking one. So there's 2 different events coming up, one on getting to grips with QMS and one as a Q networking event. Amazing. So if you've got that evaluation form open, please keep it open and finish it off. But just to make sure we cover everything before we wrap up, the only other things we wanted to say were, one, a huge, huge, huge thank you to the host. The second was just a flag. There are some brilliant visits coming up over the summer autumn period, one in person and a couple online, and more in the works. There's an amazing visit coming up to Imperial College Healthcare Trust, which is looking at 1 year on from NHS Impact and what they've been doing using NHS Impact to refresh their improvement work. There's an in-person one to Surrey and Sussex Healthcare Trust. And then there's an online one, which is coming up in October, which is on adopting innovation. So lessons from creating an innovation hub with Cambridge and Peterborough, and that's with the integrated care system. So some really fab visits coming up. A huge thank you to the team today. As you're on your way out, please do share a reflection that you're leaving with today, something that is still going through your mind, or an action or an intention to send you out. So reflection, action, or intention would be wonderful to hear that. And we look forward to seeing many familiar faces at one of our next visits. Thank you, Dom, for your contribution in the chat there as well. We'll be sending out resources before the end of this week, including the slides, and today, and this recording will also be available if you wanted to share it with colleagues. So thank you, Lee, thanks to everyone, and thank you, Dom, Felicity, Karen, Michelle. You've been fantastic hosts today. It's been amazing coming in and experiencing a bit of your world at Improvement Cymru, so thank you.
Thanks a lot, Julia. And yeah, keep in touch. Good to see you all.
Thank you so much, everyone.
Everyone.
Bye.
Take care.